I believe that COVID-19 has had detrimental effects on all children, but in particular, Indian children who live on Indian reservations are going to struggle exponentially. The isolation is very difficult for tribes and tribal children and tribal people to address. We are a collective people, and so we're a relationship based people. And so our children are used to the interactions with multiple people, multiple levels of grandmas and aunties and uncles and peers, and even the school teachers become part of their family structure. And to be denied access to these resources, these cultural resources, these relationship resources, are going to impact our Indian children exponentially around issues of social anxiety, depression, interaction. I just really feel that for Indian children who have significant barriers already to access to school, access to quality education, and significant barriers at home, substance abuse, drug addiction, um, violence, those kinds of things, which are social determinants of health, are going to impact our children. Our children who are engaged in the school system, we get a lot of relief from trauma, everyday trauma, through the school system. The school system becomes an insular of trauma for children because trauma is rampant on many Indian reservations with the recent statistics of missing and murdered Indigenous women and the loss of life and accidental death. And if you look at the statistics, Native Americans suffer all those more than any other race. And so that definitely is going to have an effect on children because the schools actually become a good insulator and a good reprieve from everyday trauma. So my concern is where will they be? Where will their mental health be? How will teachers be equipped to handle it? I believe that tribes now need to develop a child mental health plan for coming out of COVID for our children. And I think it would be good for any community to look at that.